Okay, I'm going to be talking from this video on experiences in medicine. And this came up from comments in which I heard about the recent decision by the USMLE, which is the United States Medical Licensing Examination, to discontinue the clinical examination um, component, which is called the CS. This decision actually was a decision in the right direction. And one of the ways to explain it is that initially, one of the criticisms of having that examination in the first place was to restrict people who were otherwise qualified outside the United States into coming into the system because the clinical skills exam was done in the United States. In addition, it was a bit of a repeat of what you've already learned. It made no sense why the United States medical licensing examination will be repeating a clinical exam if the people had just simply finished medical school. So it made very little sense, while what you would do over several hours will replace what you learned 6 years or 4 years in medical school. So the exam itself had no basis, but it was done, and it was done for several years. The people paid for it, and USMLE made a good and wonderful decision in discontinuing it because the basis for the exam was really incorrect. You could not expect that that exam will replace what had occurred in 4 years of medical school or 6 years of medical school, depending on the system you operated, because it could not. And therefore, clinical learning occurs throughout medical school, throughout residency, and even post-residency as an attending. And using an exam to determine that was an incorrect way. However, one of the advantages of also discontinuing both the USMLE 1 as using as a score criteria and as well as clinical skills exams means that there should be a better focus on paying attention to actual residents who are applying their interpersonal skills as well as things that are not based on just exams in choosing them for residency. Of course, I've mentioned previously that it is now a known myth among students that the only way to make money is to use what is called the road to success. And of course, the road stands R for radiology, O for orthopedics, A for anesthesia, and D for dermatology. So it made the other parts of medicine less satisfying because medical students were being made to think that it was all about money. And this has now permeated the entire system. For example, I'm a pulmonary critical care sleep physician and I'll never trade it for anything else. And you will only learn that by rotating through certain rotations in medical school for you to choose what you really like to do. And therefore, when the concentration is made on exams and exams and exams, and the whole sense of learning in medicine is removed, then we'll produce doctors that are extremely poor. What are they poor in? They may not be poor in being able to write an exam, but their compassion, their ability to be able to practice the art of medicine becomes lost. And this is what needs to change in the United States. So, in this experience of medicine, our goal is to be able to de-emphasize the role of money and success. And one of the ways to do that is to reduce the cost of medical school as a whole, and therefore reduce the need for scoring high marks in an exam to determine whether people go into residency. And I hope this finds the right ears.